So since the coronavirus started, there's been a lot of conflicting reports and some confusion about exactly how it spreads, especially when it comes to surfaces and objects. The Centers for Disease Control and Prevention says on its website that the virus that causes COVID-19 is thought to be spread mainly from person to person, mainly through respiratory droplets produced when a person coughs or sneezes. So surfaces are really not considered the main way that the virus spreads, but it's still possible that you can contract COVID-19 by touching a contaminated surface and then touching your nose or your mouth. So joining us now to talk more about this is Dr. Georgine Nanos. Good to see you, doctor. How are you?
Hi, great. How are you?
Fantastic, thanks. So let's talk about the surfaces first of all. Just tell me about that. What's the likelihood that somebody's going to contract the coronavirus because they touch a surface that happens to have it on it?
Well, there are a lot of variables that go into that answer, and it is less likely, and we've kind of thought this from the beginning, that the more common spread is going to be person to person. However, if someone is very infectious, if they're very symptomatic in the middle of being infected, and they cough what we would consider a heavy viral load onto a surface, and you touch it in close proximity to that person having just, contaminated that surface, and then you immediately touch your hands, or sorry, your face, that is certainly possible. But the likelihood of that happening is low, and kind of always has been low, which is why we're encouraging people who are infectious, who are experiencing symptoms, to stay home so we can prevent that sort of occurrence from happening.
Depends on the surface, right? Depends upon how big
Exactly.
the droplets are, how long the droplets have been there, all kinds
Right.
of things, sure.
Exactly.
Let's talk about the masks and why this is important. How effective are just these kind of cloth masks that we've all been making, maybe out of bandanas, or we've been buying at the stores?
Sure. So the masks, remember, are important from protecting other people from any infectious droplets that may be coming from your own secretions. So they're less so about protecting you and more about protecting your community and the people around you. So the idea is that if you may be, for example, asymptomatic and you don't know that you are carrying COVID-19, and say you've got, what may look like allergies, and you sneeze, and that, perhaps, comes in contact with someone else, then, you could be exposing someone who may be potentially high risk. So, these are all obviously hypothetical situations, but there's lots of them, as you can imagine, with many, many variables. So the more we can limit that spread of our respiratory droplets out into the public, the better it is for everyone.
I understand that idea that the person wearing the mask is doing it so that they don't infect other people, but does the mask on the person also help at least a little bit for them not to get the virus?
Yes, to the extent that you're less likely to maybe touch your mouth directly or your nose directly. The key still remains and always will be hand washing, hand washing, hand washing. And I can't stress that enough. The more we wash our hands or use an alcohol-based hand sanitizer, the safer we will all be. This remains the cornerstone of all infection control. So as long as you're washing your hands frequently, anytime you touch something that may be potentially contaminated, even if you're not sure, if you have access to hand sanitizer, that's really the key. And yes, the masks will potentially protect you if you are, less inclined to touch your face.
If you've got two people in a room and maybe they're 10 feet apart and they're not wearing a mask, can they still get it? There's so many hypotheticals in my mind, right? If one has a mask and the other one doesn't, or if both do, but they're in the room for 12 hours, or if they're talking loudly. Can you just kind of wrap all that up? Do you know what I mean?
Sure. Yeah, no, it's really complicated, and these are good questions. So the longer time that you're exposed, if you're in a room with someone for 12 hours, first of all, if you're stuck with anyone in a room for 12 hours that you weren't expecting, that's probably not the best thing. it depends again on how that room is ventilated. What else is going on in that room? Are you touching any other items that, mutually are touching in that room? So obviously, if you can be outside talking or meeting with somebody, that would be the best case scenario. If you are, and yes, you're right, if you're a loud talker and an animated talker, you're more likely to have respiratory droplet spread than someone who's much more quiet or subdued in their language.
Yeah, sure. So many different variables, whether you're just breathing and not talking, whether you're talking loudly, how long you're next to the person, how close you are, what the mask is made of. I mean, it's great to talk to you. I appreciate the time. I wish we could talk a little longer, but we're going to have to leave it at that. Doctor, thanks so much for the time.
You're so welcome. Remember, wash your hands.
Wash your hands. Wear a face mask. Keep your distance.
Yes.
Let's get through this together. Thanks so much.
Thank you.
All right.
Have a good night.
You too.
Bye-bye.